Welcome back to the Rick and Carter Show by Thomas Family Insurance. I'm Rick Thomas.
And I'm Carter Thomas.
In our last episode, we talked about GLP-1 medications, what they are, why they exploded in popularity, and why so many Medicare beneficiaries felt frustrated trying to access them.
Because for a lot of people, the conversation basically ended the moment they saw the price.
And honestly, that reaction makes complete sense. Some of these medications can cost over $1,000 a month without coverage. For many seniors, that simply isn't realistic.
So today, we're talking about something called the GLP-1 Bridge. And no, we don't mean an actual bridge.
No. We're talking about a temporary pathway that may help some Medicare beneficiaries access these medications at a much lower cost. And in many ways, this is Medicare experimenting with a completely different approach than we've seen before.
Now let's talk about the part people really need to understand. The rules.
Correct, because this does not work exactly like traditional Part D prescription coverage. People should not automatically assume spending through this pathway works the same way normal prescription drug spending works.
So this doesn't automatically reduce someone's deductible the way they may expect.
Correct. And it also doesn't magically reduce a Medicare Advantage maximum out of pocket either. This is assistance, but it is not a complete rewrite of Medicare.
I think people outside the Medicare world sometimes forget how tight retirement budgets can be.
They do. I've sat across the table from people who were hopeful these medications could finally help them, and then they saw the price. For many seniors, this wasn't a decision between buy it or don't. It became medication versus groceries, medication versus gas, medication versus keeping the lights on.
So for a lot of people, it probably felt like the answer existed, but financially it was completely out of reach. Which shouldn't be happening, especially to our seniors.
That's exactly right. And unfortunately, it feels like things keep getting more and more pricey as the days go on.
So here's the question everybody asks. If losing weight helps to improve someone's health, why didn't Medicare cover these medications before?
For years, Medicare law specifically excluded medications used strictly for weight loss. And historically, obesity was treated very differently than conditions like diabetes or heart disease. Sometimes it unfortunately takes a little bit for modern medicine to further evolve.
Oh, so like other conditions in the past, Medicare viewed obesity differently than it does today?
Yes, exactly. But as more Americans are struggling with obesity, doctors are discovering more research. We now understand obesity impacts nearly every part of the body: mobility, joint pain, heart disease risk, diabetes, sleep apnea, overall quality of life. It can a lot of times be the root cause of our other health issues.
So this bridge program is really Medicare starting to rethink the entire conversation and encouraging others to fix the root cause.
I believe that's exactly what we're seeing.
I think this is the part where we need to slow down and be really honest with people. Because online, these medications sometimes get talked about like they completely change somebody's life overnight.
And for some people, they absolutely can make a huge difference.
But they're still tools, not miracles.
You can't take the medication and ignore everything else.
Better habits still matter. Movement still matters. What you eat still matters. So the medication can help someone get momentum.
But lasting change still comes from the choices people make every day.
Can we talk about the elephant in the room? If a huge number of people suddenly want these medications, could shortages happen again?
Yes, and people deserve honesty about that. We've already seen shortages before, so expectations need to stay realistic. This isn't going to be some overnight situation where suddenly everybody gets immediate access.
So healthcare probably isn't going to roll this out perfectly.
Healthcare systems rarely move that smoothly.
That may be the nicest thing anybody's ever said about healthcare paperwork.
That is probably be true. It can all be so frustrating. I think this next part is extremely important. This bridge currently only runs through December of 2027. And honestly, nobody fully knows what long term participation looks like after that. A lot depends on outcomes.
What do you mean by outcomes?
If people become healthier, if complications decrease, if long term healthcare costs improve.
Then programs like this become easier to justify.
Exactly. But if costs explode and outcomes don't improve, some plans may decide not to continue participating. At the end of the day, this conversation is bigger than weight. For some people, this isn't about a number on the scale.
It's about getting part of their life back. Walking through Walmart without needing to stop halfway. Climbing stairs without your knees screaming.
Exactly. Having mobility, independence, confidence.
If anything, remember that this pathway could help a lot of people. But people need to hear this honestly. It's not magic, it's not permanent, and it's definitely not simple. But if people truly use this opportunity to improve their health, this could become one of the most important healthcare changes Medicare beneficiaries have seen in years.
And hopefully, some people improve their health enough that someday they may not even need these medications anymore. When people hear weight loss medication, they may picture vanity. But for somebody else, this could mean being able to take their grandkids fishing again.
That would be the best outcome of all. But all progress is progress.
Exactly. That's all for now, and thank you all for joining us on another episode of the Medicare Maze with Rick
And Carter. And if there's a Medicare topic you'd like us to discuss in a future episode, reach out to Trish at Thomas Family Insurance. We may feature your question in an upcoming episode.
But until next time, keep navigating the maze.